स्वागत करते हैं जी एक बार फिर आप सब ਦਾ ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ। ਐਲਨ ਗਲੈਸਰ ਸਾਡੇ ਅੱਜ ਮਹਿਮਾਨ ਨੇ ਜਿਹੜੇ ਕਿ ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਨੇ ਤੇ UBC ਦੇ ਵਿੱਚ ਕਲੀਨਿਕਲ ਇੰਸਟ੍ਰਕਟਰ ਨੇ। ਅੱਜ ਸਾਡੇ ਨਾਲ ਇਹ ਸਾਂਝ ਪਾਣਗੇ ਕਿ ਪੇਨ ਕਿਉਂ ਹੁੰਦੀ ਹੈ, ਦਰਦ ਕਿਉਂ ਹੁੰਦੀ ਹੈ, ਕਿਹੜੇ ਆਪਸ਼ਨ ਸਾਡੇ ਕੋਲ ਅਵੇਲੇਬਲ ਨੇ ਜਿਨ੍ਹਾਂ ਦਾ ਅਸੀਂ ਬੈਨੀਫਿਟ ਲੈ ਕੇ ਕਨਵੈਨਸ਼ਨਲ ਡਰੱਗਸ ਜਾਂ ਨਾਨ ਕਨਵੈਨਸ਼ਨਲ ਡਰੱਗਸ ਦਾ ਬੈਨੀਫਿਟ ਲੈ ਸਕਦੇ ਹਾਂ। ਸਵਾਗਤ ਕਰਦੇ ਹਾਂ ਐਲਨ ਗਲੈਸਰ ਦਾ। Welcome to the program.
Thank you, Harpreet.
Thank you. So today focus would be on why do we feel pain and what are the various options available, conventional as well as non-conventional, which can help us relieve from pain.
Our most common pain pills are what you can buy over the counter. Everybody knows it. Acetaminophen, brand name Tylenol, ibuprofen, brand name Advil, and of course naproxen, brand name Aleve. Those are our most common non-prescription medications. And then, of course, on prescription, we have higher dose naproxen. We have things like Celebrex. Those are the most common prescription anti-inflammatory drugs for dealing with pain.
Right.
Whatever the pain is. What are the consequences of taking those? Because they all have consequences. Every drug has more than one effect. We have the effect of pain control, but on the other side, we have the effect when you take that class of drug called NSAIDs, that's what they're called. They increase your risk of strokes and heart attack over time. If you just take them for a few days, safe, effective, probably won't upset your stomach. You know, out of every 100 people who are taking every day these list of medications, one of them ends up in hospital. Right, with a bad bleed. For every 100 people, one a year ends up in hospital.
Right.
And if you think millions of people take these anti-inflammatory drugs every day, we're talking about thousands of entry into emergency wards of hospital because there's a stomach bleed. There's a bad stomach bleed. And how many other thousands of people get heartburn first because of these drugs? If you have those symptoms of heartburn, you need to decrease the amount of these anti-inflammatory drugs you're taking. That's when it comes into saying, okay, how do we feel pain?
Right.
What is these things working on that is causing us to use them, number one, and number two, have the consequence of side effects? Well, the biggest reason why you and I feel pain is there's an injury. There's dead, damaged tissue.
Right.
And then immediately the body swells up. How many of you twisted your wrist and your hand's all pink, right? The hand's always okay. There's blood flowing in there, but you got this big swelling around your wrist and you can't move it anymore.
Right.
That's the body's natural action. Just think we're a dumb animal. We want to use our wrist when you've injured it. So that's the body's normal reaction.
Right.
And we're not happy to be in pain, that we accidentally fell down or did something with the wrist, lifted up something too heavy, whatever had happened, we've injured the wrist. And so we take one of these anti-inflammatories. Where in truth, if we can, help our body get rid of the dead, damaged tissue in there, we can help let the swelling will go down.
Right.
So I've seen that happen, and we have a natural enzyme formula that we make at Mark's Pharmacy, 80th Scott Road, that will help decrease the swelling and inflammation without you having to take these other anti-inflammatories.
Right.
There are some other commercial preparations around, but we found ours extremely effective to working with our patients.
Okay.
So number one, you can take this enzyme. Number two, for any kind of inflammation, we know that high dose antioxidants, and an antioxidant is just a molecule that gives up an electron.
Right.
And so it helps give out an electron and helps reduce swelling and inflammation. That's it. It reduces the inflammation. It's been documented. There's 250,000 trials in PubMed showing how anti-inflammatories help in multiple disease states, not only just swelling and inflammation and pain.
Right.
So there's another thing you can do. Again, we can recommend at Mark's Pharmacy, 80th Scott Road, the best antioxidants and formulas around to help control the pain. And finally, it could be as simple as when you injured yourself, you strained your muscle.
Right.
So when you strain your muscle, it can cramp up. And the muscle, though, is always attached to a joint. Right? So if you've injured your wrist or something, you might even have carpal tunnel. If we can relax the muscle in your forearm, and we have a device called a stick Typically, if someone comes in and literally in 30 seconds of rolling on this forearm, top and bottom, their pain will go from out of a 10, 8 or a 9, down to a 1 or a 2 or a 0.
So basically what happens, the muscles are getting relaxed, or
The
what
muscles get tight,
Right.
and where the muscles attach to the bone,
Right.
they rip away.
Okay.
Okay, the ligaments, they're like steel bands that attach the muscle to the bone, start to be ripped away. So any dead tissue triggers swelling, which
Right.
then triggers pain. If we relax the muscle and it's no longer pulling the ligament away from the bone, you have less pain.
Right.
That quickly, within 30 seconds, you can feel a decrease in pain.
And of course, if people come to Mark's Pharmacy at 80th and Scott Road, you can give them this free,
Yes.
stick treatment over there.
30
And they can-
seconds,
30 seconds,
and
see
they'll
the
feel
difference. Great. So as we are talking about more prescription and dosage, conventional and unconventional methods which are used for pain relief, what else is there which can help the people?
So we've talked about an enzyme.
Yeah.
We have talked about the stick.
Right.
And then we have rubs.
Okay.
We have some natural rubs. So we have multiple ones. One of the most common ones is that we prepare from scratch
Right.
a magnesium spray because there's multiple books been read about lack of magnesium in
In
our
the body.
North American diet.
Right.
Whether it's because we don't eat enough fresh fruits and vegetables, which North Americans typically don't,
Right.
because that leads to another issue called too much weight, because we're not eating the best stuff that's good for us. When you don't have enough magnesium, your sensitivity to pain goes up. So some people are so sensitive to pain, if you just touched their arm, they'd scream in pain.
Right.
Other people, you can bang them with a hammer and they don't feel a thing. They say,
Right.
that didn't hurt. They didn't do any damage. It didn't hurt. But when you lack magnesium, and we can spray it on an area, I would say 7 to 8 times out of 10, that person who comes into Mark's Pharmacy, 80th and Scott Road, and experiences that, a knee, elbow, wrist, sometimes even lower backs, within 60 seconds, I've seen people go down from a pain of 8 down to a 4. Like, we can make a difference,
Right.
half the pain sensation in literally 60 seconds.
Right.
And then you add either a oral anti-inflammatory, the enzyme to help, or if you have to, your Advil or whatever,
Right.
and then you can take a lower dose.
It was a pleasure talking to you. Thank you very much for your time.
Thank you, Harpreet.
ਅੱਜ ਐਲਨ ਗਲੈਸਰ ਨੇ ਸਾਨੂੰ ਦੱਸਿਆ ਕਿ ਪੇਨ ਕਿਉਂ ਹੁੰਦੀ ਹੈ। ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਡੈਡ ਟਿਸ਼ੂਜ਼ ਜਿਹੜੇ ਹੈਗੇ ਨੇ ਜਦੋਂ ਸਰੀਰ ਦੇ ਵਿੱਚ ਹੋ ਜਾਂਦੇ ਨੇ, ਉਸ ਕਾਰਨ ਸਾਨੂੰ ਦਰਦ ਹੁੰਦੀ ਹੈ। ਹੁਣ ਦਰਦ ਨੂੰ ਖਤਮ ਕਰਨ ਵਾਸਤੇ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ, ਜਿਸ ਤਰ੍ਹਾਂ ਅਸੀਂ ਬਹੁਤ ਸਾਰੀਆਂ ਦਵਾਈਆਂ ਖਾਂਦੇ ਹਾਂ, ਟਾਈਨੋਲ ਦਾ ਜ਼ਿਕਰ ਕੀਤਾ, ਇਬੂਪ੍ਰੋਫਨ ਜਿਹਨੂੰ ਕਿ ਐਡਵਿਲ ਅਸੀਂ ਕਹਿੰਦੇ ਹਾਂ, ਜਾਂ ਅਲੀਵ ਦਰਦ ਵਗੈਰਾ ਵਾਸਤੇ ਖਾਂਦੇ ਹਾਂ। ਇਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਹ ਚੀਜ਼ਾਂ ਹਨ, ਪਰ ਇਸ ਦੇ ਨਾਲ ਨਾਲ ਅਨਕਨਵੈਨਸ਼ਨਲ ਮੈਥਡਸ ਜਿਹੜੇ ਨੇ ਉਹ ਵੀ ਅਡਾਪਟ ਕੀਤੇ ਜਾ ਸਕਦੇ ਨੇ। ਮਾਰਕਸ ਫਾਰਮੇਸੀ ਜੋ ਕਿ ਸਥਿਤ ਹੈਗੀ ਹੈ ਸਕਾਟ ਰੋਡ ਤੇ 80 ਐਵਨਿਊ ਦੇ ਉੱਤੇ, ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਉੱਥੇ ਫ੍ਰੀ ਤੁਸੀਂ ਜਾ ਕੇ ਇਹਨਾਂ ਕੋਲੋਂ ਟ੍ਰੀਟਮੈਂਟ ਲੈ ਸਕਦੇ ਹੋ, ਜਿੱਥੇ ਕਿ ਇੱਕ ਸਟਿਕ ਦਾ ਇਸਤੇਮਾਲ ਕਰਦੇ ਨੇ, ਜਿਸ ਨਾਲ ਕਿ ਉਹ ਰਬ ਕਰਦੇ ਨੇ ਤੁਹਾਡੇ ਮਸਲ ਦੇ ਉੱਤੇ। ਉਸ ਰਬਿੰਗ ਨਾਲ 30 ਸੈਕਿੰਡ ਵਿੱਚ ਹੀ ਅਸਰ ਜੋ ਹੈ ਨਜ਼ਰ ਆ ਜਾਂਦਾ ਹੈ, ਕਿਉਂਕਿ ਜਿਹੜੇ ਡੈਡ ਟਿਸ਼ੂਜ਼ ਨੇ ਉਹਨਾਂ ਨੂੰ ਕੁਝ ਰਿਲੈਕਸੇਸ਼ਨ ਮਿਲਦੀ ਹੈਗੀ ਹੈ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਉਹਨਾਂ ਨੇ ਮੈਗਨੀਸ਼ੀਅਮ ਦੀ ਗੱਲ ਕੀਤੀ। ਸਾਡੇ ਸਰੀਰ ਦੇ ਵਿੱਚ ਮੈਗਨੀਸ਼ੀਅਮ ਦੀ ਬੜੀ ਇੰਪੋਰਟੈਂਸ ਹੈਗੀ ਹੈ, ਪਰ ਜੋ ਕੁਝ ਸਾਡਾ ਖਾਣ ਪਾਨ ਹੈ ਅੱਜ, ਉਸ ਦੇ ਵਿੱਚ ਮੈਗਨੀਸ਼ੀਅਮ ਘਟਦਾ ਜਾ ਰਿਹਾ ਹੈ। ਸੋ ਇਹਨਾਂ ਕੋਲ ਸਪਰੇਜ਼ ਹੈਗੇ ਨੇ, ਜਿਨ੍ਹਾਂ ਕੇ ਨਾਲ ਉਹ ਸਪਰੇਅ ਕਰਕੇ ਜਿੱਥੇ ਦਰਦ ਹੋ ਰਹੀ ਹੈ ਉੱਥੋਂ ਵੀ ਤੁਸੀਂ ਦਰਦ ਦਾ ਇਜਾਦ ਪਾ ਸਕਦੇ ਹੋ, ਉਸ ਤੋਂ ਤੁਸੀਂ ਰਾਹਤ ਪਾ ਸਕਦੇ ਹੈਗੇ ਹੋ। ਸੋ ਬਹੁਤ ਸਾਰੇ ਆਪਸ਼ਨਸ ਅਵੇਲੇਬਲ ਨੇ ਜਿਨ੍ਹਾਂ ਕੇ ਬੈਨੀਫਿਟ ਲੈ ਕੇ ਤੁਸੀਂ ਦਰਦ ਤੋਂ ਬਚ ਸਕਦੇ ਹੋ।